Now we're on to chapter 31, liver stuff. And when I'm studying pathophys, the way that I study is I try to find something that relates to me personally, and then that tends to motivate me to dig in deep to the science. So I'll show you what got me started looking into the liver stuff is when I started hearing about NAFLD, non-alcoholic fatty liver disease. And your book does talk about it. The last edition of the book did not talk about it because it was really considered the unknown pandemic. But I just got on, I just Googled this, and the National Institute of Health has a nice website about it. There's all the different, like WebMD now has a website where you can learn about NAFLD. It is in your book as well. Non-alcoholic fatty liver disease. This is such a big deal that this is now the leading cause of liver transplants. In the United States, if you need a new liver, chances are this is why. Liver transplants. How common are NAFLD? 30 to 40% of adults in the United States. 30 to 40%. That's a ton of people have non-alcoholic fatty liver disease. This isn't even counting the people who have alcoholic liver disease. There's people that have non-alcoholic fatty liver disease. You can have a fatty liver and never know it. And you can get blood work done and none of your blood work will be abnormal. If you get blood work done and your liver enzymes are abnormal, you have now officially progressed from NAFLD to NASH. NASH is called, is a fancy word, non-alcoholic steatohepatitis. That big fancy word just means, number one, you have a fatty liver. Number two, now your liver enzymes have elevated. And 30–40% of adults in the United States have this. And most people that have this have obesity and or type 2 diabetes. And we believe the cause of NAFLD is our diet. We know that the alcoholic patient gets alcoholic liver disease, ALD, and we know the cause, alcohol. Non-alcoholic liver disease means that this person doesn't drink much. We know for a fact that this patient does not drink much alcohol. So what caused it? Well, it really seems that it's just part of the metabolic syndrome. So meds can cause your liver to take a hit. That's what I call it. Your liver takes a hit and then your liver enzymes go up. So there's tons of potential causes for that. And viruses, including COVID, can randomly attack your liver. It's not super common. I don't want to give the impression that it happens all the time, but when it does happen, we pay attention. We had a nursing student from a couple years ago. She graduated, took her NCLEX, became an RN. 2 months later, her liver had completely shut down and nobody really knew why. Just super random. But the doctors all are pretty sure it was a virus, not COVID. This was like just right before COVID some other random cold virus, probably like a rhinovirus, or who knows. For whatever reason, it attacked her liver. West Nile virus, every once in a while we'll do that. You get a mosquito bite, everything's great, and your liver just shuts down. So some supplements can cause your liver to shut down. Most notorious supplements are mushroom-based supplements. Mushroom-based supplements are kind of notorious. So that's one of the, if you come in to the ER and your liver enzymes are elevated, they will ask you, what supplements are you taking? If you're taking anything with mushrooms in it or fungi, that's the most common culprit. Example would be kombucha. Kombucha, anybody drink kombucha? You know what I'm talking about? That's that. Yeah, it's like fermented tea. It's kind of gross, but it's supposed to have a lot of health benefits. It's a little bit notorious for shutting livers down, but almost always it's somebody who is brewing their own kombucha at home, which a lot of people do. I have a lot of nurse friends who do that. It's kind of like brewing your own beer at home. Kombucha has just a real small amount of alcohol content in it, but anyway, notorious for shutting your liver down. Most commonly, though, is the standard American diet. Again, seems to be the culprit. And if you think about how certain body cells don't require insulin for the uptake of sugar, some of your liver cells are examples of that. So they're just sucking up sugar and turning into fat globule. And I was told that I had this probably 5 years ago, just on a routine. I had a routine ultrasound, I think, of my gallbladder. And the doctor's like, oh yeah, you got fatty liver. And I was freaking out. And then I did a lot of research on it. And with alcohol, alcohol-induced fatty liver disease, the exciting thing is if we can talk somebody into quitting alcohol, and it doesn't take very much alcohol per day to cause this, like 2 drinks if you're female, 4 drinks if you're men. And what we see almost immediately, if we were to biopsy your liver, like stab a needle in there and take a little sample of your liver cells and look at those cells under a microscope, we would see a round cell, but inside of the sort of plasma area of the cell, big old fat goblets, or looks like Crisco, big old droplets of Crisco right in the middle of your liver cell. So with the alcoholic, if alcohol is what caused that, let's say you drank 4 beers a day for 2 weeks, you now have a fatty liver. If you quit alcohol, it reverses itself very rapidly, like 2 or 3 weeks of no alcohol, and the liver is back to normal. We're not sure if that's true with diet, but it seems like it probably is. So if you're eating Krispy Kreme donuts every day, and then you just cold turkey it and shift over to a more high protein type diet, less carbs, it seems like the fatty liver will start to improve itself. Anyway, I would encourage you to look into that, because I bet if you don't have it now, you'll get it eventually, because it seems like all of us Americans, some statistics that I've read said up to 80% of us have a fatty liver, but for sure up to 40%. The big thing to know about the liver is that it just does everything. It does everything. Hepatitis is a very common condition worldwide, and that is something to be aware of, the different types of hepatitis, because for a long time, that was the leading cause of death in nursing, the nurses who get hepatitis. And a common scenario would be a needle stick injury. So a nurse who stabs herself with a dirty needle could get hepatitis C. And for a long time, that was the leading cause of death in nursing. I mean, not a lot statistically, but it was enough to be #1 cause of death in nursing. I Googled this recently. On the CDC website, they list the leading cause of death for each occupation. And right now, believe it or not, the leading cause of death in nursing is falls. Nurses who fall at work, hit their head just right. Something to think about. You ever think about how cluttered a patient's room is? Have you ever gone in a patient's room and like hit your shin bone on the bedside table or tripped over the oxygen tubing or something? So do think about that whenever you go in a patient's room. I want you to think in the back of your head, oh, the leading cause of death in nursing is what just happened to me. I almost fell. So when I say leading cause, like in 2019, there's 6 nurses, I think, that died in the United States from falling at work. But hepatitis and needle stick injuries, though, something that should terrify you as a healthcare provider. Surgeons actually have the biggest rates of this problem. Surgeons are always cutting themselves with the dirty scalpel or stabbing themselves with a dirty needle. So the liver is located in the right upper quadrant. The hepatocytes are the cells that do all the work. Your hepatic artery supplies blood to your liver. Your liver does have the gallbladder sitting right there underneath of it. So that's a very common source of pain, is a bad gallbladder. The gallbladder dumps into that common bile duct, which your pancreas also dumps into. Bile is made by the liver and stored in the gallbladder. The hepatic duct empties into the common bile duct. Bilirubin is that yellow colored compound, which is a result of red blood cells breaking down. So when somebody's liver is completely shut down, they tend to be very yellow. We call that jaundice. And the first place that we tend to notice it is in the whites of the eyes. They start to turn a little bit yellow. If you've got some jaundice, that means your liver has, your liver enzymes have skyrocketed. So the progression of alcoholic liver disease and non-alcoholic liver disease, #1, you get fat in your liver. #2 step is now your liver enzymes have gone up, not including your bilirubin. Once your bilirubin starts climbing, that's the 3rd phase, and that's when your liver is officially shutting down. So in nursing, we always are looking at people's eyeballs, looking at their skin to see if it's turning yellow. That's the final stage of that liver shutting down. I'm just skipping a bunch of these slides. Some of the basic functions of the liver: fat metabolism. The liver is very important for breaking down fat. The liver creates cholesterol. Cholesterol has a bad rap. We're always talking about, oh, got to get that cholesterol down. But cholesterol is vitally important for tons of processes in your body, including things like your brain cells, your brain cell functioning. They're made up of fatty acids. Another thing that cholesterol is used for in your body is that's the precursor, cholesterol is the precursor to most of your hormones. So things like estrogen, testosterone need cholesterol as their building block. Your liver also makes albumin. It makes albumin. On your case study for this liver topic, the patient had ascites. Basically, he was third spacing fluid. If your albumin gets super low, none of your fluid will stay in your blood vessels. So what that means is all the fluid in your blood vessels leaks out because albumin is the #1 protein that keeps fluid in your blood vessels, called oncotic pressure. You drop your albumin way down low because your liver has shut down, all the plasma in your blood vessels will leak out. When it leaks out, you get swelling in all kinds of places, most notably your abdomen. We call that ascites. Low albumin equals ascites, edema in your belly. The other problem with that, if you can imagine all of the plasma leaking out of your blood vessels, what happens to your blood pressure? It also goes down, it tanks. So albumin is very important for maintaining blood pressure. It keeps the blood in your vessels. If you have no blood in your blood vessels, you have no blood pressure. Albumin is very important for that. So imagine, if you will, somebody whose liver has shut down. The liver makes albumin. So now they have catastrophically low albumin. All the fluid leaks out of their blood vessels. Now their blood pressure is super low. What is that going to do to the kidneys? We're talking about liver right now. But if your liver shuts down, what's going to happen to your kidneys? They're going to shut down as well. And that's a death sentence. If you come in with your liver shut down and your kidneys shutting down, we call that hepatorenal failure, and you're going to be dead within probably a few weeks at the most. So your liver is vitally important for everything. The other thing, #2 on this slide with the protein metabolism, is it converts nitrogen to ammonia. And what can happen is a back and forth thing where if your liver shuts down, the ammonia starts to build up in your blood vessels. And so I think on that case study, did that patient start to get confused or sleepy? That's always simply ammonia levels climbing. So we check the patient's lab work, we check their liver enzymes, things like AST, ALT, we check those liver enzymes. We check their bilirubin level, and we check their ammonia level. The only reason we care about that ammonia level is as it climbs, it shuts the brain down. The ammonia level shuts the brain down. And there's a fancy word for that. It's called hepatic encephalopathy. That big fancy word, hepatic encephalopathy, just means sky-high ammonia level. Sky-high ammonia level because your liver has shut down. We treat that with a med. Does anybody know what med we treat high ammonia levels with? It's a medication that's always liquid called lactulose. Lactulose, has anybody ever given lactulose? If you're a med aid, you might have given lactulose, just a little liquid, comes in a little cup, and you have to drink it. And it says on the MAR, it always says for constipation, because it's a laxative. But nobody takes it for constipation. The only people that are taking lactulose are liver failure patients. And we give them lactulose so that they poop out ammonia. That's pretty interesting. If you hold their lactulose for a day, their ammonia level climbs and they fall asleep. They become unresponsive. First, they start babbling incoherently. They're not making any sense. They're confused. You're like, why is Joe confused? He wasn't confused yesterday. It's because his ammonia level is climbing. We give them the lactulose. He poops like crazy, and then he wakes right back up. Poops out that ammonia. The liver is responsible for managing your blood sugars. Gluconeogenesis, big fancy word, because doctors like to lead you to believe they're smarter than the rest of us. But if you break that word down, glucose is sugar. Neo means new. Genesis means creation. So your liver just makes new sugars. Liver makes new sugars. That's called gluconeogenesis. Big fancy word for new sugars. The other big thing that your liver does, very important role, is the hematologic role. But basically, your liver makes all of your blood clotting factors. Your blood clotting factors. If your liver shuts down, you can't clot your blood anymore. So what do you suppose these guys actually die from? The leading cause of death in liver failure patients is bleeding out. They bleed out. That's 80% of the time the final straw. They start pooping blood. They might rupture an esophageal varices, start vomiting blood. They might develop a bleed in their brain, a hemorrhagic stroke, because their liver is not making all those clotting factors. We took care of a patient a couple months ago. This was on 4th floor at Bryan West, liver failure patient. And right before we got there, we were doing evening clinicals. They made him a hospice patient. Once you've turned yellow, that's pretty much all she wrote. There's not much we can do other than a liver transplant. And it's very hard to get a liver transplant. And this gentleman had not stopped drinking. And so if you're still drinking alcohol, they won't give you a liver. Won't give you a liver transplant. I'm gonna stop sharing real quick. So our patient who was on the 4th floor, they made him hospice. By the end of our 8-hour shift, he was just bleeding out of every orifice. Every orifice. It's very disturbing. But he had blood coming out of his nose. He had blood coming out of his mouth, out of his ears. He was a young guy. He was a businessman. He was in his 50s, I think, in his 50s, but he wouldn't stop drinking. And so they wouldn't give him a new liver transplant. His blood pressure had tanked a couple days before. His blood pressure got really low because all the albumin got really low. All of his blood plasma leaked out. So once your blood pressure gets low, very next organ to take a hit, kidneys. Now his kidneys have failed. And then the third thing we see happen is all those blood clotting factors get really low and you start bleeding to death. 80% of these guys die from bleeding to death. So we have to be watching for GI bleeds, poop and blood most commonly. Any questions about that? That was kind of a depressing little rant, wasn't it? I wish I could say that this didn't happen very often, but it happens every single day of clinicals now, for me anyway. I would say the last 6 times my students have called a rapid response has been on this exact patient. Two times in the last year, my student has called a rapid response, a different student on a different floor. 3 times, 2 of them were on the adult mental health unit. And both of those patients became unresponsive. They became unresponsive. And my student called a rapid response. Based on what I just told you, what lab test would you want to check first if a liver failure patient becomes unresponsive?
ALT.
For some reason I can't hear you guys. I don't know what I'm doing wrong, but ammonia.
Ammonia.
If that's what you said. Their ammonia levels climb, their level of consciousness decreases. Ammonia level climbs, level of consciousness goes down. So we've called 2 rapid responses in the last year on that exact scenario, which is very difficult to treat because the only way we can get the ammonia level down is to get them pooping with lactulose. The third time we called a rapid response, I didn't do it with my students because I was somewhere off, probably drinking coffee or something, being lazy. My student called a rapid response because her liver patient started pooping blood. So I pay attention to the blood. I'm trying to reshare my screen here. Any questions so far about liver stuff? I just think that liver is so complicated. This on this slide here, it says responds to glucagon. Does anybody know what glucagon is? You ever heard of that? Yeah, so glucagon is a hormone just like insulin in that it's secreted from your pancreas, but it does the exact opposite of insulin. Insulin brings down your blood sugar. So if you check somebody's blood sugar and it's really high, like 500, we'll give them a shot of insulin. But glucagon does the exact opposite. It's a naturally occurring peptide in your body, but we give it all the time at the hospital or wherever for low blood sugars. So you might see on your patient's medication list, they have glucagon as needed. and it might say glucagon PRN for blood sugar less than 30 or something crazy like that. Get their blood sugar too low because they're diabetic and they haven't been eating, we can give them a shot of glucagon. I just wanted to put this thought in your head, because to give a shot of glucagon, there's one very important criteria that must be present. Otherwise, it won't work. What has to be present, this criteria, is your patient has to have a working liver. So if you have a diabetic patient who crumps their blood sugar really, really low, and you rush in there with a glucagon shot, if their liver is shut down, and you usually know that because you look at the guy and he's neon yellow, bright yellow, you're like, oh, yeah, that's right, he's a liver failure patient. That glucagon won't work, because glucagon requires a healthy liver to raise blood sugar. If your liver is completely dead, glucagon won't raise blood sugar. So that means you got to try something different. And usually what we try differently is we start an IV and give an AMPA D50, basically squirt sugar right in the bloodstream, right in the vein. We can't do that. Like if you work at a nursing home, the nurses, we usually can't do that. So that means we got to call 911, let the paramedics show up, because they can pop an IV in and give the AMPA D50. The liver detoxifies stuff. I would say the easiest way to remember this is if you think about alcohol. Alcohol is a toxin. I've got some alcohol right here, actually, some hand sanitizer. If I were to drink this right now, it would enter my belly. I'd probably vomit it, actually, because it's not the type of alcohol you're supposed to drink, and this stuff makes people throw up pretty quickly. If I were to drink this alcohol, though, it would first enter my stomach, it would irritate my stomach, and then pass on down into my intestines. Alcohol in your intestines, and you can see this on this slide here. Anything in your intestines then gets absorbed into your circulation, and the very first stop of anything, that you eat, anything that you drink, very first stop is that liver. It passes from your gut to your portal vein and travels right to your liver. Your liver is responsible for detoxifying everything that we eat. That's also why the liver takes the first hit. The very first hit could be from our standard American diet. The very first hit could be from the alcohol we are drinking. Liver takes the very first hit. It's trying to protect the rest of your body. It's detoxifying stuff. And alcohol is an extremely toxic substance, very hard on the liver. Other things that are hard on the liver, Tylenol, which is acetaminophen. If you take two extra strength Tylenol, that's within normal limits and shouldn't cause too much of a problem. If you take a whole bottle of Tylenol, though, it gets absorbed from your gut, the Tylenol travels to your liver tries to detoxify it. And a toxic amount of Tylenol is 10 grams. Meaning if you ingest 10 grams of Tylenol at one sitting, your liver will shut down. How much is 10 grams? One extra strength Tylenol is 500 milligrams. So 2 Tylenol is 1 gram, right? So 10 grams would be what, 20 pills? Does that sound right? Did I do that math right? If you take 20 Tylenol in one sitting, your liver will shut down. This is such a huge problem that the FDA today would not have approved Tylenol. That's the acute ingestion dose. The chronic dose, which means if you take it every day for a month, is 3 to 4 grams. So if you take 3 to 4 grams of Tylenol per day for a month, your liver will shut down. Raylene, did you have a question?
No, I have something to add to the conversation. When you're talking about Tylenol and shutting down the liver, there was a really big problem with Tylenol for babies because parents didn't understand the dosage information, which caused them to overdose their children and cause them to die. So they actually now doctors are prescribing Tylenol anymore due to the risk of that happening.
Oh, so actually writing a prescription for Tylenol so that way there's no confusion about the dose.
Yeah, like they say very flat out, you can only give them this much. You don't follow directions on the bottle. And even if you look at the bottle of baby Tylenol, it says ask your doctor for dosage information. It doesn't even give you a recommended dose anymore.
Oh, that's good, I think. I didn't realize I haven't given babies Tylenol for a while, but it's a huge problem. 3 to 4 grams per day, this is for adult, is a big problem that we see in nursing homes because how many pills is 3 grams? If one extra strength is 500 milligram, if you give 2 pills, that's 1 gram. Well, if it's ordered every 6 hours, you're giving 1 gram 4 times a day, which is considered okay, except 4 grams every single day for 30 days will shut your liver down. And then the big problem that we have is all of our pain pills also have Tylenol. So Lortab, Norco, they have hydrocodone plus 325 of Tylenol. So suddenly we're given maybe extra strength Tylenol 3 or 4 times a day, plus a couple of PRN Norcos, and we're well over that 3 to 4 grams per day for chronic ingestion. And these guys come in with their liver shutting down. We usually notice about the time that they turn yellow. The hospitals are doing much better on that problem as well. And the electronic health records, like the Epic system, will pick up on that right away too. But it's still something to think about. How much Tylenol is too much? Some Mucomist, did I talk about that already? The Mucomist? Oh, no, that was in my mental health class. She said here in class, get some Mucomist, and that's absolutely correct. Mucomist is called Mucomist because it's a breathing treatment that we give to break up mucus, but it's also a supplement called N-acetylcysteine, NAC. And if you go to Walmart later today, look for a bottle of NAC. N-acetylcysteine is actually the precursor to the #1 antioxidant that is found in your liver, which is called glutathione. And so anyway, that's a rant. When you come take my mental health class, we'll talk about that a lot because we take care of kids every single week that have tried to overdose on Tylenol. And the very first thing we do, give them Mucomist. Mucomist tastes like a rotten egg fart. If you can imagine what a rotten egg fart tastes like, it tastes horrible. At Walmart, though, they actually put it in pills, and it's an antioxidant that replenishes the glutathione in your liver and prevents your liver from shutting down, either whether it's from alcohol ingestion or Tylenol overdose. It's a very important supplement. Let's see if there's any other slides on here that we should talk about before we call it a day. The word jaundice just means your skin has turned yellow. Hyperbilirubinemia means you have a high bilirubin level. And then this chapter does go into all the different hepatitises, A, B, C, D, and E. And I will type up an exam review after class, and we'll see. I'm not sure which hepatitises are on the exam, if any, but then the book talks about the non-alcoholic fatty liver disease. Once your liver enzymes elevate, we call it NASH. And then once your bilirubin goes up, we call it hepatic failure. Your liver has failed. Once your ammonia level climbs, which is another blood test, then we call it hepatic encephalopathy. So in clinicals, we will take care of all the different stages of liver failure. Not so much the hepatitises. A lot of these patients, there's newer meds that actually are showing great results in improving the mortality of the different hepatitises and stuff. There is a slide here about alcohol consumption. The World Health Organization here in, I think, 2017 came out with updated alcohol consumption guidelines, like how much alcohol is too much. And they've dialed these numbers way down. So the World Health Organization says essentially one beer, which is 12 grams of ethanol, is toxic. It was pretty controversial when they published their reports, because every country in the world has realized that 10 grams of alcohol, which is less than one beer, is maybe safe, but you get up over 10 grams and now you are at risk for developing cirrhosis. But I wanted to point out that there's a wide variance, and you probably know people who have drank every single day their whole life and their liver's fine. And then there's other people that only drink for a couple years and bam, liver shuts down. What's the difference? The difference seems to be the genetic amount, the preset amount of glutathione that you have in your liver. Some people have a much higher amount of glutathione, and they're able to detoxify much higher amounts of alcohol without it causing a problem. But in general, 12 grams is very dangerous for your liver.